Hello, everyone. I'm Patricia Callahan, founder of Heart Solutions Counseling. I'm so excited to be here sharing with you how I help people facing cancer and other serious illness reduce symptoms, side effects, and anxiety by calming the nervous system. As providers, do you sometimes feel the emotional weight patients carry and wish there were a way to support it without adding more to your workload? You're not alone if you feel like you want to do something about that and you just don't have time to do it all. Imagine if we could take the weight off, knowing your patient's emotional distress could be effectively addressed without adding more to your plate. What would that be like or feel like for you? I care deeply about this work because I understand what it's like to live with uncertainty about your health. In my 30s, prolonged emotional stress and environmental exposure led to a severe nervous system reaction. What started as a sensitivity to mold in my home gradually spread to everyday things in my environment, eventually forcing me to step away from work and live in social isolation for several years. I tried a lot of things: meditation, prayer, strict diets, allergy shots, supplements. They all helped in small ways, but what really made a difference was learning how the brain and nervous system respond to stress and how they can change when we feel safe and supported. Working with a compassionate coach who believed I didn't have to live like this showed me that recovery was possible. With his calm, non-judgmental guidance, my nervous system was able to relax, soften its conditioned fear response, which was spreading to more and more things, and allow my brain to reframe my experiences in a way that restored equilibrium in my body. After I recovered, I returned to working and later joined cancer support community, where I found my calling supporting people living with cancer and those who love them. My own experience allows me to truly understand the fear, grief, and exhaustion patients often carry. Today, through Heart Solutions Counseling, I use a gentle, trauma-informed approach that helps regulate the nervous system. My goal is to help people facing cancer feel steadier, clearer, and more present so they can navigate care, connect with loved ones, and find moments of peace, even during difficult times. So these pictures are my before and after pictures. On the left is when I lived at the camp for the severely environmentally sensitive. Behind me is our metal kitchen. I lived in a 10 by 10 metal room. You can see I'm sitting at a metal table, so no chance for fumes or off-gassings that would trigger my reactions. And you can see that my book is in a plastic bag. I was that sensitive that I would react to the newsprint or even the ink on the page. On the right is my after picture. This is me dancing with members of the program that I grew into a flourishing success at Cancer Support Community for Spanish speakers at the gala, Living My Passion. We all know that emotional well-being is an integral part of health and that reduced stress has been shown to support better treatment outcomes. This flowchart is from a study that was done at the University of Miami School of Medicine on the impact of psychosocial stress and stress management on immune responses in cancer patients. On the left, you can see that chronic stress, things like adversity, depression, loneliness, leads to neuroendocrine processes being affected, which leads to suppressed immune system and ultimately can lead to cancer progression and metastasis increasing and quality of life and survival decreasing. But on the right are mitigating factors. We can do something about that. We can reduce those stress symptoms through social support and adaptive coping skills and pharmacological interventions when needed. Today, I'm going to talk about an adaptive coping skill that I specialize in that's highly effective. Often clients I talk to are frustrated because traditional tools like medication or talk therapy haven't reached the fear actually held in the body. While talk therapy and medication are helpful, of course, they don't always shift the brain's physical stress response. By addressing both the emotional and physical experience, We can help patients regain clarity so they can communicate more effectively with their providers, you, and stay present with the people they love. Today, you'll learn how patients can calm down their nervous system. They'll be able to regulate their emotions and listen to you better, how they can use calming eye movements to replace negative images with positive ones and remove emotional triggers, and the latest research studies on what improves patient outcomes beyond new drugs and adherence. For patients who've talked through their trauma but remain stuck in fear, accelerated resolution therapy, or ART, helps the brain reprocess memories to remove the emotional charge. This was developed by Lainey Rosenzweig, that's her in the picture, and this evidence-based modality uses REM-like eye movements to resolve distress quickly. One of the biggest benefits is that patients can share as much or as little as they want, and they can find relief without having to share every painful detail. People often go from feeling overwhelmed with fear and hopelessness to feeling a sense of calm and even joy in just one session. I've seen the power of this firsthand. My first ART client came to me for grief, completely devastated and haunted by the traumatic images of their loved one's death from cancer, which they had witnessed. By the end of our first session, they were bouncing in their seat with joy, finally able to remember the happy times. After just 3 sessions, they could even hear their loved one's voice again, something they hadn't been able to do at the beginning, which was very upsetting for them. ART works directly to reprogram the way in which distressing memories and images are stored in the brain so that they no longer trigger strong physical or emotional reactions. While the client recalls a traumatic memory, these eye movements activate the amygdala, our fear and alarm center, and the prefrontal cortex, the center for reasoning and regulation of the nervous system, enabling the client to process negative emotions, sensations, and images and replace them with positive ones. ART's founder calls this positization. You may be thinking, this sounds too good to be true. Relief from symptoms like PTSD, anxiety, or depression in just 1 to 5 sessions without having to share all the details out loud? It does sound too good to be true, until you look at the science. ART was studied early on at the University of South Florida, and these studies led to it becoming recognized as an evidence-based treatment for PTSD and depression. Clinical studies showed that ART reduced PTSD symptoms in veterans by more than 70%, and showed a dramatic drop in depression from 87% down to just 28%. Those are some pretty powerful statistics. Some participants reported the elimination of nightmares, reduced reliance on medication, and better sleep, while others reported an end to flashbacks and a renewed sense of well-being, all without having to relive their worst memories out loud. 2 studies funded by the National Institute of Health were done by the Mayo Clinic. The first was on reducing trauma symptoms in cancer patients, and it did show that ART is effective for reducing cancer distress. The second is ongoing and is on building resilience in caregivers to prevent PTSD when their loved one eventually passes. And I can share with you that in my own experience using ART for both cancer distress and caregiver overwhelm, it has been highly effective in helping reduce people's fear about the future, which is often so debilitating they can't function, and helping them live life in the present and enjoy the time they have. Now that I've given you the basics about how ART works, I'd like to share with you some of the benefits experienced by an actual cancer patient that I worked with. These quotes are being shared with permission. The name and photo have been changed to protect the client's privacy. This is Evita, and she says, after just 4 sessions with Patricia, I went from living in constant panic to finally feeling in control. I conquered my fear of making medical decisions and regained the freedom to drive, be home alone, and even step into an elevator without anxiety. I'm no longer trapped by fear. This is a patient who had had cancer in the past and developed all these anxiety symptoms that she's talking about finding relief from when she came to me. She'd been living cancer-free for several years when she came to me and had been diagnosed with a second cancer and started the whole fear process spreading to more and more things in her life again. We were able to clear for good all of those symptoms in just 4 sessions and give her her life back. I know it's frustrating when a patient is too overwhelmed by fear to process the care you're providing. ART is the perfect adjunct. It settles the nervous system so patients can focus and work effectively with you. If you have 1 or 2 patients this week dealing with the shock of a new diagnosis or maybe the hopelessness of a recurrence, please send them my way. I'm always available to discuss these cases with you. Here's my contact information. Thank you so much.